The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
More than 37 million Americans suffer from migraines. For those with chronic migraines, the symptoms are debilitating. But could there now be a breakthrough permanent fix? This is Ronny's story.
I've been having migraines for about 14 years. I would usually wake up with a pain in the back of my neck. The pain would spread to the front of my forehead, into my eyes and into my temples, and it would come along with a really intense nausea. I would vomit over and over again. I was completely unable to function. I was bedridden. I couldn't work. I've tried medication, diet and exercise, lifestyle changes, stress management, acupressure, massage. I used meditation as a way to manage the pain. I actually considered becoming a monk. I saw over 15 doctors and dentists, and none of them brought me any relief. I started to lose hope, and that's when I met Dr. Peled in 2017.
Probably the biggest misconception is that all migraines are caused by some kind of abnormality inside the brain, whereas in reality, sometimes they're caused by compression of nerves outside the brain, caused by scar tissue, spastic muscle, abnormal blood vessels, and this was absolutely the case with Ronny. So we first did an operation where we released all the nerves in the back of the head from all that spastic muscle and completely eliminated the headaches in the back. And today we're going to be focusing on the remaining symptoms, which are in the front and the temple. Let's get started. So here we already have our auriculotemporal nerve, and you can see it twitching in there, see that? So that's his heartbeat, and that's an artery. Right next to it is this really tiny nerve, and so every time that artery throbs, that nerve is getting banged, and that gives you that throbbing headache. And that nerve has now been removed. All right, so we just finished with Ronald. Everything went exceptionally well.
Dr. Ziv Peled and his patient, Ronny, join us now. And Ronny, it's been a number of weeks now since we were watching that procedure on tape. How are you doing?
It's a miracle. I mean, I'm almost 100% pain-free at this point.
Wow. I'd say that's a happy patient, right, Doc?
Yeah, absolutely. I do a lot of different kinds of operations, and these patients are by far the happiest.
So you are a plastic surgeon, and one of the areas that we do is what we call peripheral nerve surgery, and that's what you're doing in this particular case. So walk us through why he was such a good candidate, and again, exactly what you did.
Right, so the ideal candidate is someone who has been diagnosed as having migraines from either a board-certified neurologist or headache specialist, someone who has failed conventional therapies, usually a whole host of different drugs from a number of different drug classes, conventional therapies such as physical therapy, massage, various injections. Number 3, people who have a good physical exam that shows that there's a peripheral nerve, meaning a nerve outside of the skull, that's causing their headaches. And 4, if they respond to an injection of a numbing agent or local anesthetic in the office, and they have a great result, for example, the headache goes from 9 to 1, as was the case with Ronny, that shows
I love that. You're sort of pre-testing the waters before you actually go in there and start cutting nerves. You make sure that, hey, this is the nerve that's causing this problem, this headache. I blocked it. He's feeling better. Okay, let's do a neurotomy or neurectomy.
Right, that's exactly right. That allows you to identify the nerves that are causing the problem in question. It also gives the patient an ability to sort of test drive what their results could be and how much numbness they might have if you have to cut a nerve, which fortunately in many cases we don't have to.
So Ronny, I'm curious, do you have any areas where nerves were cut where, okay, I don't have feeling there anymore?
Sure, it's a good question, because before I had surgery, my biggest concern before doing the surgery was the risk that some nerves might be cut or excised. And that kind of scared me, and I was a little apprehensive, but at the same time, the pain was so terrible that I had no choice. But the fact that some of my nerves were cut, not all of them, but some of them, I haven't had really any noticeable side effects from that. I have a little bit of numbness in the back of my ear where one of my nerves was cut. And because I had one of my surgeries recently, I'm still having some numbness in my forehead.
A heck of a trade-off, right?
Oh yeah, I don't even notice or think about the numbness ever.